Hello, we will begin now with our organ systems, cardiovascular first. So we have a next lecture on the heart itself, but this one we will talk about hypertension, high blood pressure, arteriosclerosis, varicose veins, what it means to go into shock. So we'll begin with these kind of topics in this lecture. Indeed, I think you all should know what's going on in this picture right here, taking blood pressure, and we'll begin kind of a little bit of review of arteries and veins and such, but a really short one. So first of all, vascular system, all those arteries and veins. And as you feel your radial pulse here, you feel each pressure wave that comes from systole in your heart. It's pushing that blood through, and that relaxation in between when the pulse goes down is diastole, of course. And any blood that leaves the heart goes through an artery. Then the capillaries is where action takes place, right? Capillaries are the tiniest, where there's exchange of oxygen and nutrients and waste. All the big arteries and veins you see in this diagram here are just like highways. They're delivering the blood to where it belongs. And besides delivering the oxygen and nutrients, this is how hormones get around. How we just talked about your immune system. It's how the white blood cells hitch a ride. All everything you absorb in your gut is carried through here, as well as pulmonary function, oxygen, carbon dioxide. So cardiovascular system right at the heart. That was completely by mistake, but it works just perfectly. Your lymphatic system, it's not talked about as much, but we're talking about your lymph nodes. And you have swollen glands here. You certainly get your attention, and your spleen is involved with that. And so the cardiovascular system and lymphatic system work together. Cardiovascular system carries blood, and the lymphatic system carries lymph, a watery fluid, extracellular fluid that allows this fluid to go through your body and be filtered, and your lymph nodes get a look at it, your immune system. So it's really nice before that watery fluid goes back into the veins. So it's continuous. We have a closed circulatory system, right? The blood goes out the left side of your heart, out the aorta, to your systemic arteries. And then capillary beds occur everywhere, in your gut, in your skin, your muscles, the capillary beds. And those drain into venules of veins that return back through the inferior and superior vena cava to your heart. And the pressure in your veins is so low. It's a real problem, actually, getting that blood back, especially from your legs, because it's just lost all that blood pressure it got from your heart as it slowly moves through the capillaries. Looking at the structure of artery and veins, you should know the three tunics. Tunica intima is going to be a layer of squamous cells, and wicked important, as we talked about with inflammation, how those squamous cells, they change when there's when under chemical signals, when there's an infection there, right? And they start putting out sticky stops that the white blood cells will stick on. And so with the effect of histamine, the capillaries, they'll swell and become more leaky or come back. So that intima, it's got to be a smooth layer in the inside of your vessels. It also is always sending out anticoagulating factors too. Remember, coagulation and clotting it's ready to go. All the chemicals are there. They just need to be activated. So it's the movement of blood, and that prevents the coagulation, except when you have some kind of tear and there's exposure of collagen fibers. Then you want that coagulation to happen. The media or middle is smooth muscle, and it's particularly large in arteries. You can see versus the vein. And the arteries are under much more pressure. They need a much stronger wall, and this also allows them to constrict. So your arterioles can control capillary beds. So you go in a hot tub, you're going to relax the capillary beds in your face, and in your skin, you get all flush, get all red. And then you go out on a cold day, and you get kind of ashy on your skin, because those capillary beds, that smooth muscle will constrict on those, and they'll open up in your core. And tunica adventitia is the outer connective tissue that'll be around arteries and veins. And big arteries even have, there's called vasa vasorum. There's the vessels of the vessels. They're so big they need blood vessels to get to the outer part of them. And the lumen is the space in the middle that the blood flows through. Yeah, and look at arteries and veins. You guys studied this before, but veins are wimpier, thin-walled. Some veins have valves in them, arteries don't. Yeah, and arteries are thick-walled, a lot of elastic tissue. They're able to get that pressure, especially the aorta, right off your heart. The ability to store that pressure when that elastic fibers is critical. So your blood pressure, you know, it's 120/80, something like that. It's your systolic over diastolic. And systolic is when the heart is contracting. It's the highest blood pressure. When the heart relaxes, the blood pressure goes down. And it would go sky high and rock bottom if we didn't have elastic arteries and veins. If our vessels are made out of PVC piping or copper, our blood pressure would just spike and come down. But it's that elasticity stores the blood pressure and releases it between the heartbeats. And blood pressure, there was a formula you should know for BP. It equals cardiac output times peripheral resistance. So cardiac output is going to be heart rate times stroke volume. So that's how hard your heart's working, how fast and how strong it's pushing out the blood. And your resistance is the resistance. That's going to be the biggest factor is how you can constrict those arteries and increase the resistance. Just like in a garden hose, when you put the little tiny nozzle at the end, the pressure increases. And if you want to drop blood pressure, you relax those vessels and the pressure drops. So yes, those are the two important things. You also have the viscosity of your blood and the length of the blood vessel. But those are smaller factors. The diameter of the vessel, the radius is the power of 4, as opposed to the length and the viscosity are just by themselves. Yeah, and so that's how we really instantly control blood pressure. You know, if you guys, the blood pressure drops, you just bleed a lot of blood, your vessels will constrict, your body will constrict them to try to bring that blood pressure back up. Normal, you know, if you're above 120/80, and these things change a little bit. They recently changed some of these numbers, what is called pre-hypertension and then hypertension and then dangerous hypertension. There's no real low values put on this, but you can be hypotensive to low blood pressure, and then you fainting and not enough perfusion in your brain and your kidneys. But we really worry about hypertension causing a lot of damage. So the veins, very little pressure as it comes back, and so they're thinner, and some of them have those valves that just keep the blood moving so it can't drop down in your legs. Imagine gravity pulling it down, but if you squeeze your muscles and the blood is squirted up, and then it stops, squirted up, it'll ratchet its way back eventually. And all the action, all the interesting stuff happens in the capillary beds. These are just the diameter of a red blood cell, so they're really wicked thin. They just consist of that endothelium. They don't have any muscle, no connective tissue on them, so very thin blood cells can just squeeze by. And capillary beds themselves, you have them all over. They can be open or closed. The arterioles have the valve that can either relax or constrict. And so you eat a big meal, the capillary beds in your gut open up. That's why you don't want to go swimming. Mom always said, don't go swimming after you eat, because then, you know, your blood can't be both for digestion and for your muscles. You're not going to die, though. I think you guys know that. Yeah, and capillary beds, when you guys work out aerobically, you know, you can increase your capillary bed density, gives you more aerobic capability. And tissues that are more active, you have more capillaries than tissues that are not as active. Yeah. And what's going on there in the capillary beds, and I'll talk about a couple times here, is that the blood pressure is going to push out the fluid. Osmosis tends to suck the fluid back in because there's more stuff dissolved in the blood, but blood pressure is high enough that there's a net outward flow. And at the venous end, when the pressure is dropped, there's a net inward flow because of osmosis. And that's the way it should work. And any excess is carried off by the lymphatic system. I threw in another one just from remembering. Here's a typical capillary. It's very leaky, and especially the ones, you'll see the ones, oh my God, you're in your glomeruli of your kidney, they have big holes in them. In your liver, they're just big spaces. And then in your brain, remember you have that blood-brain barrier. The brain, all your capillaries are surrounded by these astrocytes, by these glial cells that make this barrier so that toxins and such just can't get into the brain. They've got to get through this gatekeeper of the helper cells. So yes, like I say, blood pressure is pushing this outward flow. It pushes your kidneys, pushes outward flow, all produced by the muscle of your heart, the ventricles of your heart. And osmosis is going to suck it back in. Do you guys remember what kind of proteins you have in your blood that are just there for osmotic purposes? Albumins. Albumins, your liver makes all these proteins. And if you're protein deficient, you can't, or you're starving, you can't make enough albumin, you tend to have edema. You have swelling of your tissues. This just shows on one leg, so there's another issue there. It's not just a protein deficiency, but the fluid leaves, but then the other end, not that much gets sucked back in, not enough. And so you have a net swelling of those tissues. So edema, we're going to talk about in this lecture quite a bit, is when you have fluid in tissues. Yeah, and this shows some edema. This kid, you can tell his face looks swollen. And this one, when you press in, it leaves a mark, you know, it's just because you push the fluid out, it just stays there. Yeah. And take a look, what could cause edema? Oh, lots of things. So increased blood pressure. Yeah. Or reduced osmotic pressures if you don't have enough proteins in there, like malnutrition. You've got renal disease where you're peeing out too much of the proteins that you should be keeping. Liver failure, because that's where you make the proteins. Indeed. Inflammation causes edema. You all know that, the histamine and then some other chemicals keep the vessels dilated and leaky. Lymphatic obstruction, especially the one leg that we just saw that picture. Lymphatic vessels are supposed to carry it away. And if you have a tumor, something like that, it's going to block the lymphatic vessel. Or I'll show you a worm gets in there. Your fluid builds up, you know, upstream. Yeah, definitely surgery. You get something cut out, you have stop the lymphatic flow sometimes. You gotta look at that. And sodium retention could be a kidney problem, could be another problem. It's going to cause you to retain water. And another thing here, you can see heart failure is gonna, if the heart can't pump out the blood, it's gonna back up. It's gonna cause a back pressure. And the increased pressure is gonna mean more fluid is gonna leave. Definitely. And we'll talk about the renin-angiotensin system. Remember that? Kidneys, they give off renin, and angiotensin will increase blood pressure. And yeah, if you have greater blood volume, you're gonna have greater blood pressure, and you're gonna have more edema. And here, malnutrition, or your hepatic means liver, it's not making it, or your kidneys getting rid of proteins, gonna decrease the stuff in your blood plasma. And that's gonna decrease the osmosis, and less fluid will be sucked back in. Yep. So many causes of edema. Yeah, so that hydrostatic pressure, the outward pressure, is caused by your blood pressure. You increase your heart rates, or how strong your heart muscle contracts, you're going to increase your blood pressure, which means more fluid will leave your capillaries. But hopefully osmosis, on the other hand, is going to suck back that fluid and return it to your bloodstream. And the lymphatic system will also take any excess and bring it back, but you can overwhelm that and then the tissue swells. So showing the lymphatic system, yeah, the lymph vessels are microscopic, just like the capillaries. They're dead end. You can see that they start out in like a cul-de-sac and they all meet, and eventually they'll make their way back to your veins through a couple big ducts. But that's a difference there. Capillaries are open on either end and the blood flows through it. Lymph vessels just take the excess fluid in, just because of increased pressure on the outside just brings it into lymph vessels, and then muscle movement and contraction will just slowly bring the lymph back into your blood. And on the way, back to your bloodstream, you got these great lymph nodes that can take all that fluid and look for bad guys, look for debris. And so it's a great spot to catch that. Lymph nodes in your armpit will swell when you have an infection in your arm. The lymph nodes in your cervical region will swell if maybe you have some kind of nasal problem, infection. In your groin, those lymph nodes will protect against your lower limbs. All right, so you guys got it. Lymph is a fluid that'll be carried back. The excess fluid will be carried back, and it dumps into the big veins above the heart. all that fluid that was collected, and it just goes back into the blood. Yeah, beautiful view here. Oh, that's gorgeous, huh? You can see that excess fluid picked up here, lymph nodes, little like a filter on the way, and all that fluid gets back in the bloodstream. I think I said it all, actually. You can see you have all these hundreds of lymph nodes, particularly in places where you're going to have infection. To be sentinel, or they'll be looking for infection distally, where the water is going to be coming back. Yeah. Lymphedema, you can see here some of these amazing pictures. See how swollen limbs can get. And usually some kind of obstruction. Like I say, you got a tumor that's going to be obstructing the lymph vessel. And it's a slow motion thing. But it's the fluid is a small amount, but over time, you know, your limb is going to swell, and they got to get in there. Look at that. Tumor, scar, inflammatory destruction, surgery, something like that. Yeah. And a type of lymphedema is elephantitis. And this is caused not by a tumor blocking a lymphatic vessel, but by a worm. So a worm, it's carried by mosquitoes. And see, it's not in the US, but tropical parts of the world, this exists. And you'll have scrota will be the size of like basketballs, especially lower limbs, you see that. And the skin, even from chronic edema, will get scaled like an elephant's. That's the idea there. 120 million people, yeah. So it's a huge problem worldwide, just not here. Arteries can also be sinusoids, like a sinus is a space. And here I threw in a picture of a liver histology. And so in certain places, in your liver and your spleen especially, the blood goes through these sinusoids. And it's a place where you can work on the blood chemistry. You can look for aged blood cells and destroy them. You can help filter the blood. And then you also see capillaries are very leaky in adrenal glands. I mean, in endocrine glands, like the adrenal gland, and pituitary, and thyroid. Because you just have product being, you know, dumped into the sinusoids, these big capillaries. All right, so let's get to the major problems here. So first of all, atherosclerosis, hardening of the arteries, and you know it's a huge problem. It's one of these it's asymptomatic. It can be like high blood pressure. So you've got it, it builds. And we even find this starts young in your 20s and 30s. It's really genetically determined, diet, of course, but it's something that just builds and builds and builds. And your problem is going to be when the arteries become clogged, and then a clot can block them, or it weakens the artery wall and an aneurysm can grow and burst. And so it causes problems along the way. It doesn't hit all your arteries equally. Your coronary arteries, your carotid arteries show atherosclerosis more than your renal arteries in some other places. So there's some mystery too why atherosclerosis happens in some places other than others. But what you'll get in the lining of your wall is fatty deposits, and they start out just as these kind of streaks, and then they grow. They're going to get into the eventually they can make their way through the artery, more of it, but it kind of builds on there, and you have this fatty, and then calcium gets kind of hard. And look at a cadaver, you can look at often the coronary arteries or the arteries in the brain, they crunch, and you can look in there and see this yellow plaque on there. And so you're narrowing the lumen, causing higher blood pressure is necessary to push the blood through, and it's more dangerous because a smaller clot can get clogged in there. So myocardial in your heart or cerebral infarcts, when the blood supply is cut off, that tissue will die. Yeah, that's looking at the greatest cause of death and morbidity in the US. So clearly this is very important to understand this. And a thrombus is a clot. And it can, if it's moving around, we call it still a thrombus, but also an embolus. And emboli are moving particles, and they're usually clots, but they can be a piece of fat or an air embolus. And so the problem is they may be fine in a big vessel, but they're eventually going to get to a smaller one in your brain or your heart, and they're going to stop, and they're going to clog up and stop the blood flow and cause an infarct. It's going to kill the tissue beyond it. Yeah. Usually thrombi These clots, they start in the deep veins behind your knee, in your leg. The blood tends to pool, especially if you're not moving, and kind of like turbulence or pooling, you know, are going to cause coagulation factors to start coming out, and you make this clot, and it's fine in the back of your leg maybe, but when it breaks loose, the next place it goes is back up to your heart and then to your lungs. You get a pulmonary embolism where it gets clogged there. Let's say it makes it through there, it gets back to the left side of your heart, out the aorta, then it goes up your carotids to your brain, and there's tiny little vessels in your brain. It stops there, causes stroke. So these thrombi can cause emboli, and emboli can travel and get stuck in some really bad places. All right, varicosities, varicose veins. The veins start failing. The blood pressure is not much to bring the blood back, and the veins will swell, the valves become incompetent so that blood keeps falling back down. And there's various surgical techniques, lasers to go in there and help with that. Hemorrhoids are going to be when you have the vessels in your anus, they get swollen like that. Yeah, so we'll talk a little more about that. Hypertension, of course, high blood pressure, right? And that is going to increase your risk for all kinds of things: heart attack, kidney disease, aneurysms, right? So this hypertension, and as I mentioned in an earlier lecture, there's 40%, a huge number of people that are just untreated for it, you know? And if you don't get regular checkups, you don't know you have high blood pressure. You don't walk around like, my pressure seems like 140. You can't tell. And so it's insidious. It's hidden, and that's why you need to keep checking it. You know, that's the importance of good preventative health care. What causes hypertension? We'll talk more about it, but a lot of cases, you guys know what idiopathic means. We don't know what causes it. You have high blood pressure, we can't really find a cause. You'll see it's quite common. Yeah, and with this narrowing of the arteries here, your pressure is going to go up and up and up. Because remember, the diameter of the vessel, the smaller it is, the more pressure. The bigger it is, the less pressure. So you're automatically, not only are you narrowing the lumen, but you're also reducing the elasticity of the artery. So it's more solid, like a PVC pipe, and it can't expand, and your blood pressure is going to shoot up. All right, a little more about edema. See, pitting edema, that's what we call it, when you can press your finger in, ooh, and it stays, you know, and then it slowly comes back. Yeah, there's clearly something going on there. Again, it could be these many causes of edema we'll talk about. One of them is having the high blood pressure. Other is low proteins in your blood. If your heart is failing, if you can't pump out the blood is going to back up, and it's going to cause edema. You got a patient with congestive heart failure, you'll see their legs are swollen, their neck is swollen with all this fluid backing up. And the problem is your heart can't get rid of it. And so the pressure builds up behind it. Now, on the right side of your heart pumps blood to the lungs. If the left side is failing, it can't get rid of it. The blood backs up in your lungs. You get pulmonary edema. You get fluid coming out in your lungs. So whenever there's more pressure, more fluid comes out. And yeah, that's a problem. Other causes of edema, the conditions, you can have it around the eye sockets, pulmonaries when water builds in the lungs. Ascites here is when fluid comes out in your abdomen. And so fluid will build up in your abdomen. That's what you see in starving children. You often see, why is the belly swollen? It looks like they've eaten a big meal, right? But no, it's that they're protein deficient, and there's fluid building up in their abdomen. Yeah, a really bad one, increased edema in the brain, because your skull is so solid, it's not going to expand as an adult. Remember what it's called if you're an infant and you have high pressure in your skull, it causes hydrocephaly, because the skull can come out because it's not fused yet. But in the case of an adult with a fused skull, if you have increased cerebral pressure, it could cause the brain to herniate down through the foramen magnum at your brain stem, right? Involved with breathing and heart rate and all these things. So very, very not good. All right, so what kind of symptoms, what kind of signs are you going to see this happening, right? Hypertension, you just got to take blood pressure sometimes. But you can take a look and you can see, is this causing infarcts or ischemic atrophy? Is the lack of blood supply causing cell death, tissue death? And it usually causes pain. You have an infarct. So that'll be a good symptom. Mm-hmm. Yep, the edema, when you see that, it's a good sign. You can, when you listen to the lungs for pulmonary edema, if there's water in there, with breathing, it sounds kind of crackling, like it's kind of like the water is like foaming up in there. So you'll be able to tell that. Or percussion, you'll be able to tap the pleural cavity and hear if there's fluid, it sounds a little bit different. And with ascites, you can tap the belly and you see this, there's fluid in there, too much fluid. It's always a thin film of fluid. This is when it actually starts building up. And you can take a fundoscope, is looking at, really the only way to look at tiny blood vessels is you look in the eye and you'll be able to see back there a good view of the vessels. And you'll be able to tell, looking at that's where the optic nerve comes in. Be able to tell if there's brain swelling, because the optic nerve is part of the brain. You'll be able to look at it there too. And obviously a sphygmomanometer used for blood pressure, or they have the cuffs to measure your blood pressure. So you got to keep it heart level. The cuff is apparently not as accurate still, as what I just read from last semester, than taking it by auscultation, by listening and such. Although it's a hell of a lot easier to slap a cuff and digital readout, right, than listening. So hypertension can be asymptomatic. Walking around, you got high blood pressure. If it's really high, critically high, you may have headaches and dizziness and see this. Hypotension, if you have too low blood pressure, maybe some of you have had that, you may pass out. You may feel like you're going to pass out. And with low blood pressure, your main organs are your brain and your kidneys. If they don't have enough blood pressure, your kidneys fail, they stop working. And very quickly, this is the problem with shock, is that if your blood pressure is too low, your kidneys aren't perfused, those kidney tube cells start dying irreversibly. Yep. And obviously your brain has to be perfused or you pass out or go in a coma. So we can tell blood pressure, not only, you can measure your pulse, and it says the fullness of pulse, but the quality of the pulse, because you can have a rapid, shallow pulse. It usually happens when your blood pressure really drops. It's just a very weak pulse, but often rapid, because your heart is trying to compensate by speeding up, but it doesn't have enough fluid usually to push, and so you'll feel a shallow, rapid pulse. Yeah, you can take a look. If you see veins in the neck popping out, you know that there's an issue. And if you really need to look at the blood pressure, they have pressure sensors you can actually put into a vein, or even an artery. It's more dangerous getting in the artery, lots of pressure there, to measure directly the pressure. So we measure indirectly with a sphygmomanometer, but you can measure direct pressure even in a heart chamber with a barrow, a machine that we slide it in, and you can take that directly like that. So, like I said, to really the only way to look at the small little vessels is looking in the back of the eye. You can look in there, and things like diabetes, really dangerous because it can make you go blind because it affects the small little vessels in the retina. Yeah, and you can make an angiogram, and they do this. In this case, they are injecting a radio-opaque dye. They snake the thing up through a vein, even in your groin. They snake it up, and they follow it on a picture, on a screen. And then they release the dye as they take a picture, and they can see if if you have an occlusion here or narrowing here, and they can measure that to know where to go. And here's what I'm done with the cerebral arteries. Pretty cool. So angiography is the way to look at a picture of the arteries. All right, let's get to some diseases here. Angiomas. So angio means blood vessel. We talked about neoplasms in cancer. Angiogenesis is cancer cells like to make new blood vessels grow, right? And you do too if you're trying to heal. It's like in the heart, if you have a heart attack, you want to put angiogenic factors to try to get vessels to grow in so it can heal. But cancers, on the other hand, you want to stop them. You want to kind of starve off their supply. So angio, blood vessel. Angiomas, you can see this often. This is a port wine stain, a really big one. Blood will be reddish or bluish because you're seeing the blood vessels in there. Indeed, and Lymphangioma is the lymphatics that are dilated. You don't see as much. It's often disturbing. You look at some pictures, huge groin are up here where the lymphatics are just super dilated. And they usually go away. Yeah, so blood vessel, some issues are these little cherry angioma, little red things. All right, arteriosclerosis. This is a huge problem with us. And it generally means artery, sclero means hardening. Scleroderma is a disease where your skin, collagen gets hard. So hardening of the arteries, arteriosclerosis. And it's a big term. Technically, you can see arteriosclerosis is hardening, thickening of the artery. You'll see calcification happens in this tunica media. And then atherosclerosis. People throw these around, both of them, and I mean, you may see me do that, but atherosclerosis is really when you build up plaque in the inside of the artery like that. So there's a little bit of difference here, but you know, arteriosclerosis, hardening the arteries, and you can see what's actually going on here. So it is degenerative. We think it occurs early, depending on your genetics and your diets, and it doesn't cause problems for decades, right? You get overall narrowing. And then all of a sudden in your 50s, you know, one of these arteries in your heart, coronary arteries, get small enough that if you're really like shoveling the snow, all of a sudden you feel angina, you get chest pains, and it goes away. And then you should get that checked out. And they'll do an angiogram like, oh, damn, your anterior descending artery is 60% occluded. You know, okay, we need to go in there with maybe a balloon, that angioplasty, put a stent in, or make a bypass. And so that's what's going on. Builds up early. And so you can screen for these things for how your arteries are, but most people don't. All right. Yeah, so you can see it'll start out, let's see this fatty streak. You'll see, macrophages probably eating some fat and deposit. You'll see the beginnings, and then you'll see a fibrofatty plaque, and then it gets more complex in there, and it can burst and bleed and weakens the artery. Yeah, and I'm seeing that, you know, how small that opening becomes, right? Yeah, and so you're going to damage, it's from damage of the endothelial layer of your vessels, the endothelium, the inside layer. Smoking, it definitely is a big contributing factor to that. Yeah, these lesions, these atherosclerosis, these lesions can build on your arteries, get bigger and bigger, and get harder, calcify, and get cholesterol crystals in there, and you lose the flexibility, you narrow it. A thrombus, a clot can form right from it, or somewhere else can get blocked in there. Yep, and so you're narrowing the lumen, causing ischemia in that tissue. Less blood flow is getting to that tissue. And that's the case with like angina and then a heart attack, is that you've narrowed the lumen, decrease the blood flow, your heart's going to feel pain, and then if it's blocked off, it's going to have an infarct where that part of the heart will die. You can also get, if the vessel is going to be damaged by this, it's going to weaken the wall and cause an aneurysm. And an aneurysm is a ballooning of a vessel, an artery. And you're going to see this as a big problem in cerebral arteries. Your abdominal aorta can get an aneurysm the size of a tennis ball. And it's okay to have an aneurysm. It's a weaken though, but if that bursts, tremendous bleeding. Yeah, coronary arteries, big problem. Aortic, if you have an aneurysm in your aortic aorta, aneurysm of the aortic, of your abdominal aorta down here, so where the abdominal aorta is going to split into the two common iliacs arteries, and that's a place, imagine a river, it comes down, it splits, there'll be a lot of pressure right there, it can blow up. You can palpate, you can feel this pulsing mass in your abdomen if you're looking for it. And then when you see its aneurysm in a vessel that serves your leg, your lower leg, something like that, you can get less blood flow to your foot and cause problems. So this atherosclerosis. generally agreed that it's a chronic inflammatory process. You guys know about that. So you have damage to that endothelial lining, and fat will infiltrate it, and it's like scar tissue that forms. And your diet, you hear about, I have too much cholesterol, you're going to definitely be a risk for atherosclerosis. And indeed, that is true. So looking at risk factors, hyperlipidemia, high levels of fat, especially LDL versus HDL, high blood pressure, smoking, diabetes, obesity. Yes, these are the big ones right there. And then also age, family history. It's more in males and females, stress and how active you are too. But so these are risk factors involved with atherosclerosis. Mainly have a healthy lifestyle and have good genetics, really, that's what it comes down to. And don't smoke. If you smoke, if you quit smoking, it will help a big time. And so pretty much once you have it, you deal with the complications. You deal with the heart attack. You fix where you can. You can go in and kind of rooter, or you can get like what plumbers do. You can go in, kind of scrape away that plaque with surgery or remotely. You gotta be really careful that little piece of plaque doesn't get loose and go, cause a stroke later on. But and then statins, take a simvastatin, torvastatin. Statins are drugs, very low side effects, and they decrease your cholesterol and levels in your blood, your LDL HDL ratio. So here's something. There's some thought even that everyone over 40 should be taking statins as a preventative measure. I say no side effects, but there's you can look it up. But anyway, statins are they're cheap drugs, easy to take, and it keeps your cholesterol down so that if you take it for years and years, it will, hopefully push off your atherosclerosis until you die of something else. So yeah, they can go in. I show a picture here of doing a little surgery. And when you see a stent, not stint, but stent, that is a kind of a wire mesh they put in to keep the vessel from closing again. So it goes in and expands, and it keeps it open like that. Yeah, they can go on ultrasounds. They can put in a fake little thing. Well, we have like the stent in there. They can do this surgery here, arteriectomy. They can go in there and take out a piece, pull out the plaque. Angioplasty is a balloon that goes in, stretches it out, and you take it away, and it may come back. So a stent will keep it open, right? Or you can take and move arteries around. But mostly, prevention is the way to go. These things, they all kind of chip away at the symptoms and try to fix it, but it's tough once you have atherosclerosis. So yeah, a good diet, don't smoke. And even smoking bans have been shown. Secondhand smoke has caused, you can look at the data, hospitalizations down for coronary issues where this happens. It's beautifully shown. So the chemicals in smoke keep your heart beating faster, the nicotine and all, and definitely contribute to it. So this hypertension, what a huge problem. 80 million Americans, right? Wow. All right. And we don't really know, of course. There's people walk around with hypertension that have no idea because they don't get it checked. They check at the dentist and the doctors. And go to your CVS and you can test it yourself. Or you guys can do it at home. I bet you have stethoscopes and sphygmomanometers. You can have hypertensive diseases when you always have high blood pressure, and one reading doesn't do it. You need several readings really to be sure about it. But transient hypertension happens transiently, right? You have anxiety. Obviously, it goes up when you exercise. If you don't, there's a problem actually. So your blood pressure is higher when you exercise, and it comes back down. But so you can have hypertension that comes and goes. And if it's way up there, if you're way up there, you need to go to the doctor immediately because your chance of a stroke, things like that, wicked high when you have really high blood pressure. You're just like a ticking time bomb. There's so much pressure that an artery is going to give somewhere, or you're going to blow out a kidney and things like that. It's just not made for that high of a pressure. Yeah, and everyone's a little different. You know, if you're 121 over 80, like I got high blood pressure. No, you know, these are averages. They're just, you know, they're above that, but these numbers are not magical. You know, 120 did not drop out of the sky is, you know, this number we should be at. It's just what we find when looking at lots and lots of people. And you could have systolic or diastolic hypertension, right? Let's say you're at 120, you're 119, you're good. But your diastolic is at 90 or 95 all consistently. Then you have diastolic hypertension. And there's little differences there. We're not going to get into it, but you have hypertension in one or the other, you can see there's little subtleties to those differences. They may look different places to try to look to fix it. Now, there's something you can take too, mean arterial pressure. There's a formula, you look at it, you can see 1/3, it's up there on the screen. It just gives you kind of a mean arterial pressure, just like it sounds. It's another measure, and it's kind of what's the average blood pressure in your body at a time. And remember, your blood pressure, I'm just going to repeat it because it's important, cardiac output times resistance. So there's two ways to increase your blood pressure. Increase your heart rate, or stroke volume, how strong your heart goes, or increase your resistance. And the main factor there is diameter of the vessels. Close it down, blood pressure goes up. This is what goes into cardiac output also is blood volume. Sure, the more fluid you're retaining, the higher your blood pressure. So a main way we deal with hypertension is give diuretics. They make you pee more, get rid of more fluid, and your blood pressure will come down. And then cardiac output is your heart rate and also how strong your heart goes. So a drug here might be beta blockers, or to slow down the effect of adrenaline on your heart, so it slows your heart rate even if you're anxious, and that's going to decrease your blood pressure. So in hypertension, essential hypertension means you have high blood pressure. We're not sure why. You know, there's many reasons. We can't really pinpoint. When you see secondary hypertension, it's like secondary to something we can put our finger on. We got the cause of it. You got a tumor on your adrenal gland. You got too much epinephrine. We can fix it and your blood pressure will come down. Essential hypertension is usually idiopathic. We don't know. It's just primary essential idiopathic hypertension. High blood pressure, and it'd be nice to find the cause because then we can kind of fix it there. But if not, if you have essential hypertension, we just look for drugs to go at it, diuretics, beta blockers, things like that to try to lower it. Your kidneys are huge. People with kidney failure, you're going to see big blood pressure issues. Now, I'm not going to review all of this, but you know your kidney at each, remember that's called, at each nephron, what's going to secrete renin, what's going to measure your blood pressure and measure sodium levels in your tube. Juxtaglomerular apparatus, right? There's a little thing right next to there where the tube comes up, right next to where the arteriole goes into the glomerulus. And when blood pressure drops or sodium levels drop, it secretes renin. And renin goes into your bloodstream. And in your bloodstream is angiotensinogen, this protein made by your liver. And it's going to convert, renin converts angiotensinogen to angiotensin 1. That does nothing. Angiotensin 1 goes around, and when it hits these enzymes, ACE, angiotensin converting enzyme, it's going to make it into angiotensin 2. And that's powerful chemical that raises your blood pressure through many ways. It causes you to, your sympathetic nervous system to make the arteries constrict. That'll increase your blood pressure, makes you thirsty. It's going to increase the amount of fluid you have. It's going to secretion of aldosterone. That's going to make you retain sodium, retain salt, retain water, increase your blood pressure, and it's going to influence ADH as well, so that you retain more water. So it works all over the place, angiotensin 2, to increase your blood pressure. Yeah, right? Remember aldosterone, sodium retention in the kidneys. You retain sodium, and you retain water, blood pressure goes up. So some pharmaceuticals, indeed, ACE inhibitors. You're going to block, there's a couple ways to do this, to block these enzymes that are going to convert angiotensin 1 to angiotensin 2. Therefore, you don't make angiotensin 2, and you don't do all those things to increase your blood pressure. So it keeps your blood pressure lower. And then diuretics, important. Maybe grandpa's on water pills. You know, water pills make you pee more. Diuretics, we call them. And it's going to get rid of water, which is going to lower your blood volume, lower your blood pressure. Yeah, and we don't even mention, we'll mention some other things to keep your heart rate down too, like beta blockers. All right, and so some of the things, renal is kidney, those disorders, you're going to have acute renal disease or less blood flow to the kidney. All these are things, if you have renal problems, you can have high blood pressure. Other things too causing hypertension. Again, idiopathic or essentially means we have no idea. It's just you have high blood pressure, and that's most cases. But we can sometimes find some cases, some renal problems, right? Endocrine problems. So your adrenal gland secretes, well, epinephrine. Adrenaline is going to make your heart rate go faster. Aldosterone is secreted by the cortex of the adrenal gland. That's going to make you retain sodium. Yeah. Antidiuretic hormone from your pituitary. Thyroid hormones are going to increase blood pressure too. So it could be an endocrine problem. Neurologic problem. It could be, you can see sleep apnea and lots of stress, things like that are going to increase your blood pressure, certainly. Of course, go right to the heart, maybe you've got a problem with the heart itself. And then toxemia, similar to preeclampsia. You guys have heard of that. It could turn into eclampsia, a serious condition in pregnancy, high blood pressure, and some other issues. So they really worry about that if you have that. So these are things where they can see secondary, they can put a finger like, oh, okay, here's some causes. Is it kidney? Is it endocrine? And neoplastic, we didn't even talk about that, but or is it something with the heart itself that we can fix? And so if you have hypertension, what's the big deal? High blood pressure, you're walking around with it, at least you don't have low blood pressure, you're not fainting all the time. Well, this constant high blood pressure is gonna take a toll. You can see here, your heart usually is gonna get hypertrophy. It's the cause of the high blood pressure is your heart. So the left ventricle is gonna be just thick and strong. And as in hypertrophy, that's not cool. Like, hey, I'm an athlete, I've got a big, strong heart. It turns more rigid, it gets larger, but it just doesn't, the increased ability to pump it out goes down and down as your heart gets older. So it's not the good hypertrophy of your heart. Your eyes, those little tiny retinal vessels get damaged, and your kidneys too. You're gonna have kidney issues too, and you can't live without the kidneys too. And blindness. You get high blood pressure is going to be greater chance of stroke and aneurysms, right? The greater that pressure, the vessels are going to be under more pressure. And sometimes malignant hypertension, that's really bad. We're talking about here, your blood pressure is so high, you're getting headaches and convulsions maybe, or you're going to get in a coma and die if your blood pressure gets really, really high. And here's a view of a retina where you have really high blood pressure, and those little blood vessels are getting just strained and strained. So very high blood pressure is, you need to go right to the hospital. They need to bring it down. So screenings, got a picture here just of a Walgreens or a CVS, something like that. You can go in and get that done a lot of places for free. You can test that even if you don't have health insurance to go get a checkup. And again, you want multiple readings. If you have one elevated reading, you're not good. And you guys, you got to study all this. You want to not have a lot of caffeine or alcohol. You want to be sitting, don't cross your legs, keep your do it the heart level. All these things, you can get elevated heart rate readings if you, for various reasons, you want to be rested. You want to take a couple ones over days to really know if it's just transient hypertension or if it's a serious hypertension. You need to start doing things. And they may look, first at changing lifestyle choices, and then drugs can be used as well. Yeah, and maybe you don't even have any hypertensive readings because you didn't get it checked, but you go into the hospital because you have some organ damage, and like, oh, you've had hypertension, you go in for a stroke. I'm like, oh my God, did you know your blood pressure has been elevated? No, I just didn't look at it. So easy way to test for screening is hypertension. Just take a blood pressure. So your prognosis, if you have hypertension, you have issues that happen. It really depends on how serious, how high your blood pressure is. Definitely, whether there's other background diabetes and things are going to cause a problem. How early they catch it, how long you've had hypertension, yeah, and can you have less stress? Can you not eat that bag of salty chips every night, things like that? Can you exercise, And then again, I'll talk about, I think really soon here, the drugs that are available. Yeah. So what's important is to make that diagnosis that you have hypertension. There's many people out there that just don't know. Yeah. And if you can actually find out if it's secondary, if it's not essential hypertension, then they can get to the root of it. You got a tumor on your adrenal gland, something like that. If they can do that, they can cure it, definitely. If not, they'll look at lifestyle changes and drug therapies. Many different ways you can go at hypertension. Yeah, and look at the drugs. And you look, interesting talking to my pharmacist that lives in my house here. It's my wife. When they look at hypertension, it's interesting that looking at African Americans, how they respond to ACE inhibitors is not that well. And so you look at race and age and to make these decisions on where to go first. That's where the big money comes in from learning what's the best steps here that research has shown. So you can see if it's a young, under 55, ACE inhibitor, just go with that. If you're older or Black patients, you can see they don't like to do that. They go with a calcium channel blocker or a thiazide diuretic. It's a type of diuretic works on the kidney. And you can see if that does not have the effect of lowering blood pressure, then you have best practices to look at to try to do that. But ACE inhibitors or these other blockers will stop you from making angiotensin 2. Diuretics make you pee more. Easy to do that. Beta blockers will go to the pacemaker of your heart, and they're adrenaline analogs. They fit into the adrenaline receptors on your pacemaker that normally would tell it to speed up. You block those, and even if you feel anxious, your sympathetic response, your heart doesn't respond, it stays low. Yeah, and calcium channel blockers too. They work on heart muscle to keep it from contracting. All right, that's it for hypertension. We've talked about causes, treatments. All right, now we got a couple other things to talk about. Vasculitis. You see that. You look at pictures of it. You'll see usually inflammation of your vessels, with not really understanding why. Not necessarily infectious, but just maybe autoimmune, where your vessels will be enlarged and show these kind of things here. Yeah. And then, yeah, unpredictable, many effects. But usually you have inflammatory lesions of your vessels, vasculitis, right? Looking mostly arteries, but veins too. Raynaud's. I have a friend that has this. I've known a couple of people have this, and it's a strange one. We don't know what actually causes it, but we know what happens. You go out in the cold, and all the blood does not come to your extremities. Yeah, and then it's like not just, oh, I get cold and my extremities get cold. This is like serious. You can see the blood leaving your extremities, and then it comes back and they turn all red when you go back in the warm. So you get usually idiopathic. Yeah, we don't know. And so sometimes stress can trigger it too. So Raynaud's, you may run into that. Thrombophlebitis is going to be indeed, it's a thrombus in a vein. Usually these deep veins in your legs, clots can form usually it's when you have pooling of blood, slow blood, and that's going to make the clotting factors like increase. Like normally if you just blood's flowing, it washes them away, and you have clots forming. Or clots can form over artificial valve where there's turbulence going on too. But anyway, clots, you don't want them to form abnormally. Big problem. Because those thrombi, those clots can travel and cause pulmonary embolism, cerebral embolism, myocardial embolism. Yeah. So yeah, there's all kinds of anti-coag drugs, and they can remove bigger clots too if they need to. Varicose veins, that is when the veins become enlarged and inflamed. Yeah, not good. Hemorrhoids are when these veins are around the anus, internal, external ones where the veins feel a lot of pressure, you're pregnant, or a lot of pressure. Those veins can just balloon out and then they can burst and bleed too, or be very painful. That's what a hemorrhoid is. What can really kill you is if you have esophageal varices down at the where esophagus enters your stomach, and these can be big blood vessels, and they burst, you can bleed to death, and it can be life-threatening right there. Yeah, and especially varicose veins in the legs. And so my pharmacist friends, they stand on their feet for hours and hours, wear these special hose, right? Yeah, and then in the hospital they have machines too that will. Because you're immobilized after a surgery, often that they kind of like move the blood along. They're called compression stockings, and this is like a mechanized version of it. So all very important, especially after surgeries. They like to don't like to keep you immobile because of the potential of clots forming. All right, shock. Not like I'm shocked by my grade or something like that. Shock is when you have low blood pressure and potentially life-threatening when you go into shock. And so you guys are familiar with this, right? And so you pass out, your blood pressure drops, you're not producing any urine. And so you need to fix this right away, or you're gonna have kidney damage, brain damage, things like that. Yeah, so different kinds of shock. Cardiogenic shock, we're talking about the heart can't pump out blood enough, so your blood pressure is low because of the heart. Hemorrhagic shock is if you have a lot of blood loss, so that's going to drop your blood pressure. Septic shock, when you have infection, all over infection, and the bacteria is producing toxins, and the vessels dilate, and your blood pressure just drops. So get antibiotics for that. And so the problem with shock is that it causes ischemia, especially I'm thinking about your kidneys and your brain. And you guys in the medical field, you'll hear about ARDS, acute respiratory distress syndrome. Talk about that with COVID a little bit too. They'll often put people prone or do things because you have a filling of your lungs with fluids and issues. And so shock can lead to that, or coagulation issues too. Yeah, so yeah, a lot of issues. You can see someone holding the legs up. That's one of the things you want to do, is to get that blood from the extremities, get it back into your core, to your heart. A name for fainting is syncope. So fainting often happens when you go into shock and your blood pressure drops. So you want to take care of the problem. If it's a septic shock, put antibiotics, replace a bunch of fluids. If it's a hemorrhagic shock or blood products, give them that definitely, and repair what's going on, right? And when you see that, you can see this person here, the eggs, well, not their eggs, maybe they're eggs now, but their legs definitely elevated there. Yeah, give a bunch of fluids to bring that blood pressure up. And besides, drinking IV gets the fluids in there quick, right? Get your heart pumping, maybe give them some epinephrine, things like that, get that blood really going, yeah. And then again, take care of coagulation problems, take care of infection problems. All right, last slide. I always put the finally to remind me, so I don't get surprised here. So yeah, with lack of blood perfusion to organs, the organs are gonna go through, going to be damaged for sure. Like I say, you can have tremendous morbidity and mortality when you have issues with blood pressure. We keep it just at the right place, don't we? I mean, it ranges. Obviously, when you guys work out, it goes up. When you rest, when you sleep, it goes down. But just so necessary. And all the vessels are going to be the tubes that are carrying it. And if you push it, there's going to be a leak somewhere. It's going to burst somewhere, and you can die. Yeah. All right. All right, what a good chapter. I mean, some major important things are hypertension and atherosclerosis, right? These are things that are going to deal with all the time, major issues. So we covered those there and some other things, and we'll be ready to talk about issues with the heart itself next. All right.